And it's typically in there when you buy the shoe. The laces are already going through that, but if you get different laces, people sometimes forget to go through the tongue, and then the tongue of the shoe can slip. And so having the lace in the tongue actually helps to hold the tongue in place, which is important for fit. And what reminded me of that is, one of the things on the tour is sometimes the tongue has actually got elastic bands that attach to the inside,
Yes.
bed, and those help hold the tongue in place, but they can also be irritating. And so oftentimes we have to snip that elastic so that the tongue can sit in the right spot. So I mean, there's just the lacing system with the tongue and how that fits is, I mean, it's a lot to consider. And there are actually some good websites. You can Google, right? You can go online and just look for like alternative lacing techniques for running shoes. And some of them will tell you like, oh, if you have a high end step, you can lace your shoe like this. If you've got a flat foot, you can do that. And there's some good information in there. So people can always look that up if their shoe doesn't fit quite right, or if they get injured and then their shoe doesn't feel right after they've recovered. Sometimes you need to just alter how you do the laces because the shoe's still okay for you. So that's kind of the more obvious one. What we see in a lot of people is they'll start to wear out one side of the heel versus the other, depending on how their heel strikes the ground, and that'll start to wear. So when the bottom tread, that's the part that actually has the friction for the ground, when you start to see a spot that's completely worn, where you no longer have that tread, it starts time to start thinking about getting a new shoe, right? Because you don't want to get to a point, and I actually don't have any shoes because I don't do that. You don't want to get to a point where like this shoe has some black and some white. Like let's say I was wearing the heel out, and this one's pretty well worn, so the texture of the black isn't there anymore. But if I kept wearing this, the black would actually wear off completely. And then you would see that it's back to this white. You're down to the EVA or this midfoot stuff. You do not want to wear a shoe out to a point that you no longer see that other color, or that the outsole is gone. So the wear and tear on the bottom is one of the obvious signs. This is where your cushion comes from, your shock absorption. And this part can wear out before the bottom, depending on what you're running on, right? So you'll start to look for cracks or little signs of wear. Sometimes they even get little holes in there or whatever, but normally it's nice solid white. This one's again pretty new, so there's just a little bit of a wrinkle kind of right through here, but this looks nice and solid. Compared to an older shoe, you'll start to see that it's full of little cracks and wrinkles all through that. So that's when it's starting to lose its cushion. And you can kind of squish the shoe, put a hand inside and squeeze, and then kind of top to bottom squeeze like that. And you can get a sense if that's gotten really too squishy or it's no longer firm underneath your foot. And what comes inside the shoe is called a sock liner, right? And that's just this little piece of foam that generally doesn't really have any support. They're typically about 5 millimeters thick. And then they have, some kind of a top that will be anti-friction, or that can give you, moisture wicking or something like that. And the idea of this is it's literally just there for a little bit of extra cushion, a little extra shock absorption and comfort, because inside the shoe, what's in the footbed there is often a really hard material, right, to provide the support that you need. And so having just that underneath your foot is not very comfortable, and it can be quite hard. So the little sock liner can be really helpful. And again, if the shoe fits you the right way, if you don't have any previous injuries or anything, this with a good sock should be all that you need. Off-the-shelf orthotics are usually just arch support. They don't typically have any correction in them, right? So all they're going to do is kind of provide a little something. If that's the arch of your foot, it's just going to come up and kind of meet it there. And it may not meet your foot exactly where your arch is, right? So if you think about this bend being your foot arch, and you buy an off-the-shelf orthotic and the foot arch is over there, you've got a gap there. So it's not actually helpful. So it needs to be something that's actually going to fit in the right way. And their job typically is to maybe stabilize the heel a little bit. So there'll be a little bit of a cup underneath the heel, and then there'll be a little bit of support underneath the arch. And that can be if somebody has just maybe a slight inefficient mechanic, right? Or something like that. And they're generally pretty good for most people. So there's a few different brands out there that make off-the-shelf orthotics. The one that you find most common that people typically go and look for is Superfeet, and they're great. And then Superfeet has 5 different ones, right? There's some for performance, there's some for diabetics, there's some. So you really want to look at the one that has the right amount of firmness or density that feels good under your foot. And that if you're a runner, I would look for one that is more performance related or athletic related, because that also is going to have a little bit of give for that particular sport. And then you have, I mean, there's so many different ones out there, right? Some that are just more for cushion, that have a little bit of arch support. Some that have a actual rigid plastic bottom, that come in there. So the off the shelf ones are great. If you go to a specialty store that is a footwear store, that they have people that know what they're doing there, they can help you pick out an off the shelf orthotic that might be right for you, or certainly seeing a professional, a physical therapist, athletic trainer, some chiropractors, they might actually be able to help you with that as well. I wouldn't just randomly buy one. And or if you do, then buy several and you can try them all out to kind of see what feels the best for you. Unless you're having a lot of inefficiencies or injuries or recurring injuries, I wouldn't go for a custom orthotic. And if you do a custom foot orthotic, then there needs to be something that goes with it, right? You don't just, there needs to be therapy that goes with it. So typically you want to be doing some exercises to strengthen your foot, to try to improve it, some hands-on work to keep the foot joints and mechanics working the right way, massaging your calf, doing some really good stretching. Like just sticking an old orthotic in your shoe and not doing anything to try to support your foot naturally when you're not in that orthotic is kind of crazy, right? And a lot of people do that. A lot of practitioners, like, oh, well, I went to the podiatrist and he gave me an orthotic and then sent me home. Okay, great. He didn't do any hands-on work. He didn't give you any exercises to support, it's the same thing as like what I always complain about is like blood pressure pills. Oh, you have high blood pressure. Here, take this pill so it's not high blood pressure. Well, how about you figure out why you have high blood pressure and fix that?
Right.
The orthotic is the same thing. Like, okay, here, we're going to support your foot, but we're not going to do anything to change the cause of what's wrong with your foot or your mechanics. So a custom foot orthotic can be helpful for sure. But it really needs to be appropriate. So I would recommend seeing a professional. So if you've had some little issues and you've tried an off-the-shelf orthotic and it's not quite right for you, you're still having some stuff, then go see Lisa or go see somebody that understands that can help figure out if sometimes an off-the-shelf you can just tweak a tiniest bit, right? You can put a little post on it or even some metatarsal pad on there just to splay the toes, and that makes all the difference in the world. So yeah, there's so many options that are out there, and you don't need a custom orthotic, right? Unless you've really
Right.
specifically been evaluated for that. So don't go let somebody talk you into spending $200 on a running shoe and then $700 on an orthotic, that when you can oftentimes just use what's in the shoe.